times, and we have to deploy extraordinary cooperation to fight this virus. I would like to also acknowledge the important work that our healthcare workers and the frontline workers are doing. As I keep saying, these are people that protect us, and we must be very deliberate in protecting them. As of 9 a.m. East African time, the world has reported more than 5.5 million cases of COVID-19 in over 200 countries, with unfortunately over 350,000 deaths. In Africa, 54 countries have reported 124,482 cases of COVID-19, with 3,696 deaths, giving a case fatality of about 3%. The good news is that about 51,000 people who were infected in Africa have recovered from COVID-19. We must celebrate that. The question everybody is asking ourselves is, where is the trajectory? Are we seeing a flattening, or are we on the rise? I think the answer is we are on the rise. Since the last briefing that covered the week of May 21 to May 27, there have been 30,000 new cases reported, compared to last week where we saw 21,700 cases the week of 14 to 20th of May. This represents a 1.4 more time increase compared to the last week. We are seeing an average of about 4,200 new cases per day on the continent. Some of this is truly due to the increase in testing. This week, the Southern African region accounted for 30% of the new cases, followed by North Africa with 24% of the new cases on the continent, the West Africa with 16% of the cases, Central Africa with 15% of the cases, and East Africa with 13% of the cases. There are 5 countries with the highest cumulative number of cases, and they include South Africa with 25,000 cases, Egypt with 19,000 cases, Algeria with 8,800 cases, Nigeria with 8,700 cases, and Morocco with 7,600 cases. These 5 countries represent 57% of all cases reported in Africa. It is important to note that Sahrawi Democratic Republic is still the only African country without a case. Now, let me go to activities that Africa CDC and the African Union Commission are doing. As we have discussed in this forum several times, we have moved from preparatory mode to a responsive mode. And this week, I'm really pleased and excited to announce that we deployed or implemented one of the most complicated response activity, as far as I know, in the history of disease response on the continent. This included Africa CDC working with the Peace and Security Council of the African Union and the Peace and Security Department to deploy a military craft from Cameroon to the Democratic Republic of Congo to pick up 28 very skilled epidemiologists and disease responders and deploy them in Cameroon, Niger, Burkina Faso, and Mali. Very, very complicated operation that requires that we cover ourselves diplomatically, we clear all the airspaces, that the governments give the authorization for landing of a military craft in these countries, and that shows the kind of integrated assets approach that the African Union Commission is deploying to bear to support the member states to fight this pandemic. It also shows the strong leadership that the head of states, headed by President Ramaphosa and the chairperson of the African Union Commission, Chairperson Musa Faki are employing to fight this pandemic and using everything that the continent has to move around. It has never happened on the continent. The second thing that is worth noting this week is the announcement or the launch of the Kofi Annan Global Health Leadership Program. And the leadership program has three components. One is the Kofi Annan Global Health Leadership Fellows Program, where emerging leaders in public health will come to the AU, spend time with the diplomats here, and understand that you cannot approach health from just a unilateral perspective as a disease-affected situation and then manage it, that you have to look at it from the integrity of all factors that contribute for us to developing a vision and a bold action that leads to us to successfully fighting diseases. That's the kind of bold thinking and visionary thinking that Kofi Annan had when he was Secretary General at the UN, and that helped to launch the Global Fund for HIV, for AIDS, TB, and malaria. That's also the kind of vision that he had, where he worked with all countries in the world to make HIV/AIDS declared as a national security issue at the UN Security Council for the first time that a disease was presented there. So I think he's known globally as a champion, as one of the best global health champions that ever existed. So this global health program is aimed to support or mentor young Africans that can develop a bold vision, especially in the world that we're dealing with all diseases from a multifactorial dimension and requires multi-cooperation, bilateral cooperation, and multilateral cooperation. The second component of the Kofi Annan Global Health Leadership Program is a program that will enable us to move skilled and experienced public health experts on the continent and place them within different institutions within Africa, the Ministries of Health or National Public Health Institutes, in the spirit to support our integration agenda. We all know that Africa is moving towards an integrated free trade agreement, but it requires strong public health instruments, and we believe that this program will enable that and give us the opportunity to support countries in areas, leadership in areas that are critical. And lastly, a virtual leadership academy where a platform will be offered for the entire spectrum of the continent to share ideas on what we should be doing to advance public health on our continent. I thought I should highlight those two important things that happened. The deployment of the medical staff, which happened on the 25th of May, was symbolic because on the 25th of May, Africa was celebrating the Africa Day, the day that the Organization of African Unity was born. That is the Africa Day. And for the continent to have orchestrated such an integrated, complex operation across multiple countries with the cooperation of multiple countries was significant and symbolic in itself. So let me now move to other areas that Africa CDC has been working hard to supporting member states. You all are aware that last week or 2 weeks ago, there was a publication of a new disease that was identified in children called Kawasaki Syndrome disease. And Africa CDC immediately took that up, and we have developed medical alerts to member states, but we've moved past that. We've started training over 322 clinicians on how to manage this, to identify this situation, which is called a multi-system inflammatory syndrome. And we believe that we should be paying attention to the spectrum of diseases caused by this virus such that we can train our clinicians very, very early on to be able to address this. Excuse me. The second area of focus this week, technically, has been for us to expand our training for diagnostics at subnational level and ensure that we train people within the countries on issues related to supply chain management and procurement. So over 1,000 participants were pulled together this week, and through the distant learning provided that training. We've also provided training on the demographic health surveys package, such that it can begin to be integrated into the data collection systems from the member states, and 635 participants from 48 African countries were trained. We continue to enhance countries' capacity for infection prevention and control, and this week was the first of the 6-week series of training that we will continue to implement. I think that is what we did this week, and which is different from last week. Thank you for the opportunity.
Thank you very much, John. Some very important developments happening there on our continent. Now it is time for us to move into your questions. Before I give you the first one, let me just remind you that you can ask your questions primarily through sending your question to WhatsApp number +251 9455 02310. I'll give that number again, +251 9455 2310. The other way that you can ask your question is by writing your name and the institution that you are representing in the chat section, and we will then recognize you to put forward your comment or your question. The first question that we have today comes from Kara Anna, and she's with AP. She says, the opposition in Tanzania claims the government has not tested for the virus since May the 4th. Does Tanzania continue to test people, and what data has the government shared with you this month on the number of cases, deaths, and tests? She has that one question.
Sure. As I indicated last week, we are following this Tanzania situation very closely. And Tanzania is a sovereign state of the African Union. And Tanzania is also a signatory, of course, to all agreements that enable us to work as a continent. And when we develop our joint continental strategy, all ministers of health endorsed that, and also the leadership, the highest leadership of the continent has endorsed that. So as a continent, we also recognize that we have to understand with clarity that the war against COVID-19 will be won at the continental level, of course the global level, but at the continental level, that each individual country would have some victories, but the overall celebration of our victory will be continental, which means we've knocked off COVID-19 out of the continent. Otherwise, the continent will be paralyzed. It requires just one case of COVID-19 to start the entire cycle of infection. So the reason that I step back to say this is that the continental strategy is underpinned by the recognition that as a continent, we must cooperate, we must collaborate, we must coordinate, and we must communicate. So underneath this, with this underpinning, we expect all member states to share with us data in a timely fashion. We continue to urge them to do so on daily basis so that we can at least know what is going on. We are only as strong as our weakest chain. So if, again, it's a message to all countries, not just Tanzania, that we need information and data all the time on a timely fashion. And if there are areas that require technical assistance, the Africa CDC is a specialized technical institution of the African Union charged with the mandate to support countries to strengthen their health systems and institutions. So it means we are here to support any country there. So support for countries shouldn't be any challenge in obtaining that data. We are here as your specialized institution.
Thank you for that. We have Vinicius Assis, and Vinicius is a freelancer from Brazil, and have posted 2 questions. The first one is, how difficult is it to increase the number of tests around Africa? And the second question is related. It says, which country has the worst situation in terms of testing people?
So very, very good question. I mean, let me share the testing situation on the continent. The most important thing is that testing is improving. Okay, when we launched the PAC initiative in April, early April, I was very open to you all when I declared that our testing situation is unacceptable. We were under 400,000 of tests when we launched the PAC initiative just about five to 6 weeks ago. PAC means the Partnership to Accelerate COVID Testing. Today, I'm pleased to say that we are just slightly under 2 million tests that have been done. So between mid-April to now, we've increased our testing significantly. And countries have now adapted themselves such that they can test almost 5,000 to 7,000, conduct 5,000 to 7,000 tests a day. Countries like Ethiopia are doing that, which when we launched this initiative, the numbers were very, very low. It was around 5,000 tests overall. So that progress must be acknowledged. When we launched the initiative, we told you that Africa CDC was going to distribute over 1 million tests. I'm very pleased today to say that by the end of this week, we would have distributed 2.5 million tests. That means our own tests, the 1 million and more tests from Senegal, together with those that we obtained from the JACMA Foundation there. So that is significant. Going forward, we are working very, very actively with partners under the leadership of the chairperson of the African Union Commission, Chairperson Moussa Faki, and the president of the AU, President Ramaphosa, to unlock the diagnostic market. We are optimistic that in the next 2 weeks to 3 weeks, the situation will be very, very, very different. But we'll cross that bridge when we get there in the next 1 week, when our systems are fully in place there. So the short answer to your question is that we are making progress. We are not where we are supposed to be. Where are we supposed to be? As a continent of 1.2 billion people, if our goal is to test 1% of our population, it means we have to test 12 million or to conduct 12 million tests. So as I said, we are close to 2 million, which means we still have a gap of 10 million. And that is why the PAC initiative, the Partnership to Accelerate COVID Testing, is extremely important to help us accelerate and bridge that gap.
Thank you very much. That also answers the question that's coming from Sonia Beard, where she said, what progress has been made on the continent in regards to testing? So Sonia, I believe you have your response in that last intervention. But Sonia also has another question, and she asks, how many solidarity flights were planned, and have they all been completed?
Yes, thank you. We had planned all of last week to distribute items, commodities, and diagnostics to all 55 member states, and to a very large extent, with the exception of 2 countries, we succeeded in that. I think this was a partnership between the World Food Programme, supporting our efforts as the Africa CDC and the African Union Commission, and the government of Ethiopia, expressed through the Ethiopian Airlines. So it has been a remarkable operation that within 1 week, we were able to cover the continent in a very, very significant way. And I give my congratulations to the partnership between the World Food Programme, Africa CDC, African Union, and Ethiopian Airlines.
Thank you very much. Sarah Jerving, who is with DEVEX, says, can you please give more information on what's happening in Djibouti? Why are the cases per 100,000 so high?
So the Djibouti, let me go back to the other question about which country is not doing well or bad, but let me reverse it and say which country is doing well in testing. Djibouti is doing extremely well in testing. Okay, if you look at their ratio of testing to the population, they are really one of the countries that is ahead. So as I've said many times on this discussion, if you test, you'll find cases there. If you do not test, you will not find. So Djibouti is testing and is finding the cases there. So it's not a bad reflection of the situation. It's rather a reflection that something is working for them, where you are finding the cases. So you find the cases, you isolate them, trace their contacts, and repeat the cycle. Those that are ill, you put them under treatment. That's what we should do. That is the winning formula for us to fight pandemic, the COVID-19 in Africa. We have to test, we have to track, we have to treat.
Thank you very much. Our next question is from Della Russell with the Daily Graphic in Ghana. And Della says, tourism and commerce have a way of impacting on foreign direct investment on many African countries. However, we have been made to understand that COVID-19 thrives through travel. With the slowdown in infections in Europe and other places, will the Africa CDC recommend for member states to open up their borders to allow for movement, knowing the continent lags behind in its pandemic curve?
So we have developed two guidance documents that have been distributed to countries, just providing strict guidance on how to unlock the system in a manner that is safe and in a manner that ensures that we save lives and save livelihoods. That is the balance we have in front of us, I think, and it's a delicate balance that we have to trade off very, very carefully. But I would like to say one thing, that good public health measures to fight COVID-19 is the best economic investment for the countries. And I'll repeat that. Good public health investment to fight COVID-19 is the best way out to protect our economies. We should always remember that the cause of our economic challenges on the continent, a continent that was projected to have a positive growth this year, is because of the virus. So unless and until we beat the virus, we'll continue to be challenged with the economy. So, I mean, let that be very, very clear. Now that the virus is here, we've developed guidelines which says clearly the different step-by-step approaches that must be used for countries and the continent to unlock safely. The key word is to do that safely. Otherwise, the investments that we put in early on and which contributed significantly to blunting the spread of the virus would have been wasted if we just suddenly open it up completely and without appropriate measures. And lastly, we are saying that as we unlock the systems, we should make sure we intensify the public health approaches, which is three things I keep saying, which is we know how to test, we know how to trace, and we know how to treat people. Treating meaning management of cases there. And the guidelines that we are putting out as part of the PAC initiative clearly explain each step by step what we have to do to increase our public health measures.
Robbie from AFP asks, recent findings published in The Lancet indicate that chloroquine/hydroxychloroquine does not benefit hospitalized COVID-19 patients, but countries like Senegal intend to keep using it. What is the recommendation of the Africa CDC on this?
I think that's a very good question. Our recommendation or guidance has been extremely clear on this, that you should use, people should use chloroquine or hydroxychloroquine only in the context of clinical trials so that they can be monitored very, very carefully. We issued that several weeks ago, or if not several months ago, and we'll be happy to share it again. So, as a specialized clinical institution of the African Union, belonging to 55 member states, we can only hope that countries will listen to their own organization, the guidelines. So we issued that before the Lancet published the results, or even finished the study, because we knew that this was just taking it at a certain dosage would be toxic and dangerous for people to use broadly. So we can only do what we can do based on science and evidence, and hope that countries will follow the guidance.
We have some repeat questions. The first one from Kara Anna, and she says, which are the two countries that did not receive the solidarity flights, and why?
Oh, I believe I might be missing a country or so, but I know that Egypt did not, and Morocco yet, because just of flight issues, details of flight arrangements on landing, and these are all complicated operations that on the surface it might look like Ethiopian Airlines just left and flew there. Remember, airspaces are locked across the continent, so you have to provide all detailed information with all the specifics on the plane type, the landing rights, and everything before so I think we had some kind of gaps in communication with those two countries, but they have since, I believe, been corrected.
The next question is related to one that you've just answered, or at least the one that you took before this one, and it refers to the use of chloroquine. It's a follow-up question from Vinicius Assis, and he says, are there countries in Africa that are still using hydroxychloroquine or chloroquine to fight the coronavirus? And if so, which ones?
We know that there are clinical trials going on in several countries in Africa on the use of hydroxychloroquine and chloroquine, and I'll be happy to share that information. We have that on the slide, but I don't know that I have it in front of me. So next week we'll prepare that answer, that information, and share with you. So we know exactly which countries have registered clinical trials, which means they have gone through the appropriate vetting through their scientific committees in the countries and the ethical committees, and meet standards that will be followed up by the Data Safety Management Board. And we'll share that information next week's at the next week's briefing.
Before we move on, let me just remind colleagues of how you can ask your questions. You can send them to WhatsApp number +251 9455 02310, +251 9455 02310. Alternatively, you can write your name and institution into the chat section for recognition. I also want to remind you, colleagues, that for those of you who are in radio, an audio version of this press briefing will be available between an hour and 2 after we conclude. Moving on, let me take a question from David, and this is David Pilling of Financial Times. David says, what is the Africa CDC's stance on vaccine testing? Should the various vaccine candidates be tested in some African countries to prove the safety and efficacy in the African continent?
Thank you, David, for that very important question. I think the short answer to that, if anyone doubts our position, is yes. Africa as a whole must participate in the vaccine development spectrum, and not just in the testing, but in the research and development, the phase 1 trial, the phase 2 trial, and the phase 3 trial, if possible. I think that is our position, and absolutely no doubt about that. And let me just substantiate that by saying that we as a continent have very capable scientists that have conducted vaccine trials or clinical trials over the years. And the Ebola vaccine trials in West Africa, the monoclonal antibody trials in the DR Congo by Professor J.J. Muyembe and others. Myself, I've done clinical trials on zidovudine and nevirapine to stop mother-to-child transmission of HIV many years ago in Côte d'Ivoire. So the continent knows how to do that. But as part of a new public health order, I'm really urging that that Africa should not be just a spectator in the vaccine enterprise, but should truly be actively engaged in the entire spectrum from the R&D to the clinical trials. That is where we inspire confidence. That is where we also build trust, that it was done and tested and led by our own people, and then our people can be able to use it without any misinformation and misconception. The concept that Africa will wait until vaccines are developed elsewhere and we only receive it should begin to be altered. That narrative needs to change. And I'm very pleased that the accelerator, they are giving thoughts to that. That, I mean, Africa must be an active player there. And we have sites in Africa that understand vaccine development. The Institut Pasteur in Senegal, in Dakar, Senegal, has been producing yellow fever vaccines for many years. Hundreds of doses of vaccines for many years. And there are others. I mean, there's a group in Egypt that produces vaccines. And so the continent can produce vaccines and should be able to participate in all kinds of forms to contribute to the development of the vaccine.
Julia Paravicini of Reuters has a question that you've already attended to, but I don't know if you might have extra comment on that. And her question is, has Tanzania stopped testing? Are you receiving any kind of COVID data from Tanzania? I don't know if you have any extra
No,
comment.
I don't have anything more to say. I mean, it's a plea that all countries should share their data in a timely fashion.
All right. We move on back to Della Russell, and she says, in opening up economies, should member states institute mandatory isolation for all arriving travelers to cover the entire incubation period so as to ensure persons allowed entry are disease-free?
Countries have are putting in place different measures. So the answer to your question is, first of all, yes, there should be some measures to ensure that people are isolated or quarantine, okay, and then quarantine is really the word. But do that in a manner that respects human rights and of the people, and that's the only way that you need to earn the respect and the trust of the community. If we do that with human rights at the center, in other countries, and then on the other side, the community has to be disciplined. Okay, and really exercise at the highest level of accountability, self-accountability and self-discipline, which means a given country may say, well, if you arrive, you should stay home for the period of your incubation. And that is putting the burden on you, the individual, to respect that, which means you have to make sure that you design your home living appropriately so that you do not infect if you're infected, you do not contaminate your household, which also means you do not just sneak out to go to the shop and shop or go to parties there. So it's really an issue of accountability and self-discipline on the part of the community, but also the government making sure that we put in measures, or they put in measures that respect human rights and that will build trust with the community.
All right, we've come to the end of the questions that we've received on WhatsApp, but I seem to see that we have somebody online. Do you want to talk to us? Please identify yourself and ask your question. Hello, good morning. Good morning. All right, we have Beatrice Agulu. Beatrice Agulu, can you hear us?
Yes, I can hear you. Thank you so much.
Please go ahead.
I've been followed by, I'm called Beatrice, and I'm from the Department of Rural Economy and Agriculture. I've been following the new numbers. Is there an echo? Can you hear me?
We can hear you very clearly. Please go ahead.
Okay. I've been following the numbers coming out of Ethiopia, and in the explanation that was given, they are saying is that 55 new cases, they did not know where they came from because they had not been in touch with the positive ones. They had not been through contact tracing. So how can CDC explain these new numbers that the people have not traveled out and they have not been in touch with the victims here? So how can we explain such?
So we can explain as such that there are different phases of the pandemic, which we have always made sure that we explain as best as we can. One is that your pandemic or the outbreak starts with an imported case. So if you start with that, we know that we categorize that country as having an imported case. Then over time, you move from that imported case to a transmission within a cluster of people, which means that imported case had other contacts and the other contacts are infecting others. So it's all related to that initial contact. Then we go to the next phase where the infection has spread within the community. And there is no longer a question of, you don't really know that, you cannot relate those cases as you are describing to the initial contacts. So that becomes a sustained community transmission there. So what you are describing is justifying what we are saying, that we are beginning to see sustained community transmission within Ethiopia. And other countries, it's not just Ethiopia, many other countries in Africa are now witnessing sustained community transmission. That means we have to increase our public health measures, distancing, wearing of masks, and washing of hands. I mean, we have to increase that all the time. And it is our recommendation that the entire population of Addis Ababa begins to wear cloth masks now, especially when you go to places that require many people, because this ongoing transmission in the community. That's the reason why you've seen. Now, the testing strategy has to shift, okay? And instead of only focusing on people that traveled and came in through the airport and we know them, it has to begin to go to using what they call the influenza-like infection surveillance systems in place, which means if people are having a cough, a cold, they go to that center, they pick them up, they test them, and then they continue the tracing there. So that's simply the answer is that we are seeing community transmission now happening.
Thank you. I think I have seen Fabricius from South Africa online. Fabricius, are you still with us?
Yes, I am.
Please go ahead with your question.
Can you hear me?
Yes, we can hear you very well. Please go ahead.
I'll wait a bit. Actually, I just kicked into your webinar, unfortunately, because there was another one in Turkey. Actually, I'm interested to know if there's any update on the situations with Tanzania and Madagascar. I mean, I may have missed questions on that. It is rather an old issue, but as of last week when you had your briefing, Dr. John, there was still it seemed to me, no response from either of those countries. And I know that you know the issues I'm talking about, the failure to communicate from Tanzania on figures, and the opposition there are saying that they believe there are 412 deaths in Dar es Salaam alone, and 16 to 20,000 infections across the country. These are figures which are still being verified. But there's an independent verification process going on there because of a lack of trust in the government's statistics. And I wondered if you could respond to that, as well as the standing of the COVID organics scientific investigation. Thank you.
No, thank you so much. I think that you used some very key words there about the trust. I mean, the centrality for our ability to respond effectively to COVID-19 is building trust. I mean, with that, trust with the community, trust with the government, trust with public health officials, and trust, of course, with the media. So, and based on that, I would in the spirit of being totally transparent with you, we have not had any further updates since from Tanzania in the spirit of cooperation, collaboration, communication, and coordination since last week. So we continue to hear those same stories you are hearing, but again, as an evidence-based scientific institution, we cannot count on rumors. I mean, we count on objective reporting from a member state. That way, when we can make it public to you, we can stand behind it. But as we speak, we cannot be proud of that kind of level of support or collaboration there. But we remain very hopeful that the Tanzania will engage us, and we continue to fight this fight together, because you were not on the call. I'm repeating myself that the victory will be continental, the battles will be local, but our victories will be continental, because any one country that is affected will affect all countries on the continent. Absolutely, that is a fact that we have to live with. With respect to the COVID-19, the latest there is that we are working with the World Health Organization to establish a committee that will, a technical committee based on experts across the continent that will be part of the technical working group of the task force that will enable us to review the data from Madagascar objectively, and if need be, see how we can work with them to conduct a clinical validation of a clinical study to validate the claims there. And we'll just end by saying that, which I've said many times, it is not Madagascar versus us. It is all of us together, because we don't know where the solution to addressing the COVID-19 solution, meaning a vaccine or treatment, will come from. And that other thing we need to remember is that most of our populations in Africa rely on traditional remedies for their health care. So we are not against it, but we're only saying that as an evidence-based organization, both WHO and Africa CDC are very open and are willingly to work with the government of Tanzania. And we are also very encouraged that the government of Tanzania, through their foreign ministry, has already exchanged a letter with us expressing that good intention to work with us. So I'm really believing that it's a question of days or weeks before we sit down at the technical level to begin to map out the process of validating that or reviewing the data. And at that time, we'll be very pleased to bring that voluntarily to the media and explain what is going on. Because we owe it to the entire population, the facts behind it. And our role as a technical agency is to make sure that we obtain the best facts, the best evidence, and share it with the community through you.
We have a comment and a question from Song Bryce from Cameroon. And he says, I'm following the press conference of the Africa CDC on Facebook, and I have a question addressed to the director. I will first of all start by encouraging all the efforts being done by the Africa CDC in combating the COVID-19 pandemic. My question is, among all the medical items and commodities used in this fight against COVID, be it in testing, case management, medicine development, etc., how many are developed on our continent? In other words, what are the Made in Africa strategies put in place to ensure the well-being of Africans?
I think the good news is that the COVID-19 crisis and pandemic is forcing us as a continent to think very critically. There are several developments that deserve to be highlighted. One, in the area of diagnostics, we are working with Senegal. You all saw the video on Senegal. I want to bring clarity to that the test is not yet available. It is a prototype test, which is the test is still being developed. And they believe that when it's finally developed and it shows that it's performing well, it can cost $1. And we will work with Senegal, again, in the spirit of what I explained earlier, that we will work with the government of Madagascar to evaluate the test. We are doing similarly with a company in Morocco that is developing a diagnostic test, which is very, very advanced. And as we speak, we are shipping it for independent validation to Senegal and to Ghana and South Africa, and in some very respected and strong institutions there to do an independent, coordinated evaluation by us. We're also monitoring the situation in Kenya, where they are developing rapid diagnostics at the Kenya Medical Research Institute. So that's one area of made in Africa that is very, very encouraging and deserves to be highlighted. The second area is the production of masks. We know that many countries are now producing masks locally. And I think Kenya, Cameroon, where you are, I believe, is producing some. Ethiopia, Egypt, Morocco. Again, if I don't name countries, please don't blame me, because I didn't prepare to get an inventory of all of that. But it's just to say that before COVID-19, none of this was produced on the continent. So that is all made in Africa. All good news. And I might be missing other things there. But are we where we are supposed to be? No. COVID-19 has really become an eye-opener for us. We believe strongly that the Continental Free Trade Agreement that has gone into full action with the headquarters in Accra, Ghana, will continue to resolve this problem that we are discussing. We have to have made in Africa and be proud of made in Africa products if the continent of 1.2 billion people have to be the continent of the future, where in just 30 years, we will be 2.4 billion people if the population continues to grow like this. We cannot keep importing basic things like the ones that I discussed earlier.
We have another follow-up question from Kara Anna, and she says, and it's in relation to the chloroquine issue. And she says, you are not recommending that all clinical trials of hydroxychloroquine and chloroquine be suspended?
No, not at all. We are saying that the clinical trials, that they are going on, so we need to see the results. I mean, there are two things that usually happen in a clinical trials. One, if the side effects are much within the period of the clinical trial, it is stopped. The second thing is that if the drug is shown to be very, very effective, the Data Safety Monitoring Board will stop it, because if the drug is showing a greater efficacy, you encode it and then you make the drug available to the population. So those doing the trials, I mean, they have a data management safety board that is overseeing that, and that safety board has this independence to make a call, that they should stop it or they should leave the trial to go on. So it's not anything that Africa CDC can intervene on, as long as they're being done with the best scientific and clinical guidelines and standards.
All right, that was our last question.
Not anything that Africa CDC can intervene on, as long as they're being done with the best scientific and clinical guidelines and standards.
All right, that was our last